Well, thank you very much for having me here this evening or morning. So today I'm going to be talking about a very heavy topic, obstetric violence, and the research was done in Australia, but it most certainly can be representative of high-income countries, and because our practices are so similar. So yes, I'm at Western Sydney University and delighted to come and speak to you today. I do want to start with a trigger warning. This presentation does mention trauma and sexual assault. And like Sue said, it's really important to think about self-care. So after this presentation, and I do share quotes in this presentation, please do look after yourself this evening in whichever way that you find beneficial. I'm also going to start with my belief statement, and this seems quite simple and we all do this, but I think it's actually important to start with this and then reflect on it at the end. So I believe that all women deserve respectful maternity care, which is free from harm, abuse, and disrespect. So where did this study come from? So this is the data from the obstetric violence paper came from the birth experience study. And that is led by myself, and also on the research team is Professor Hannah Darling. Now, the origins of the study were back in the beginning of 2021, and Birth Time, who you may have seen or heard of the documentary, their producers came to us and said, you know, maybe we could do a survey and find out some more data at the same time as our film coming out. And they kind of planted the seed, and then we really grew that seed. Straight away, we wanted this to be a co-designed study, not just coming from us. Really important that our maternity consumer organisations were involved, and we've got quite a few in Australia. So we reached out and we had a consumer reference group, which was made up of representatives from 10 maternity and professional, consumer and professional organisations. We also, and this actually came from the consumer reference group, they said, we need to have this in other languages other than English. So we raised some funds. They did a GoFundMe page, and we looked for funds from different grants and organizations, and we were able to translate it into 7 other languages, which included Arabic, Simplified Chinese, Filipino, Hindi, Persian, Thai, and Vietnamese. And from those translators, we actually then created a cultural steering group. So I think trying to tell you all this is just to show that it really came from this co-designed project and framework. Although we're a small research team, we have a lot of love to give to our students, and we've had many come and join us to do projects. We've got a medical student doing a project on information around birth debriefing. We've had 2 psychology honours students do their thesis and the honours project on psychological aspects that came from the survey. We have an amazing program here in Western Sydney University where they have a summer scholarship. So during the summer break, they will give a paid opportunity for an undergraduate student to spend time with researchers. We've had 4 of those now, and 1 winter scholar that was on during the winter time. And I just recently submitted to a journal our first paper done by a summer scholar. We've had a Fulbright scholar come from the US, and her undergraduate degree was all in gender studies and was very aware of our work, and she applied to come and work with us on the BEST project, which she's been doing, and we've had funding for 2 research assistants. And very exciting, we actually have launched further afield, and we now have the BEST IC, which is the Birth Experience Study International Collaboration. We have research teams in the Netherlands, Denmark, Sweden, and Taiwan who are using our survey and getting that into their own population. And then we're working together to look at the data, to do analysis and to do comparisons, which is really interesting. And we plan for this to be a revolving survey, much like the Listening to Mothers in the US. All right, so that kind of gives you the background of the study. So now let's actually hone in on one of the first pieces of data that we looked at. So obstetric violence, what is it? And those that listened last week got some information about obstetric violence. It was first recognized in the Venezuelan organic law on the right of women to live free of violence, that's a mouthful at 6 a.m, in 2007. Which describes obstetric violence as the experience in childbirth which becomes dehumanizing, physically and or mentally abusive and intrusive. It is recognised by the United Nations as a form of gender-based violence. And gender-based violence is violence against women because they are a woman, or violence that impacts women disproportionately. However, and this was mentioned last week, the term obstetric violence has been described as antagonistic towards healthcare providers, as it implies an intentional act to cause harm. It can be polarising and often misunderstood by women and society. But OV doesn't only mean violence perpetrated by the obstetric medical profession alone, but violence perpetrated by any healthcare professional working in the maternity setting. And this includes midwives, nurses, and allied healthcare professionals. I believe that obstetric violence sits under an umbrella of birth trauma, but it's a particularly pervasive form, and it can include any of those experiences. And I think it's got an extra level of damage because it breaks all trust that you ever had with that healthcare provider. So in the survey, we asked a question: did you experience obstetric violence? And there were 3 options: yes, maybe, or no. And next to that, because we were unsure of whether this term would be recognised by women in Australia, we did put a definition, which was dehumanised treatment or abuse by health professionals towards the body or reproductive process of women. 991 women in the survey, and while I just add that we actually in the overall survey, we had 8,804 completed surveys, which does make it the biggest survey that's been done on maternity experiences. 991 women responded yes or maybe. And we included the maybes in the yeses because, you know, women might have been going, well, I'm not sure, maybe I did, I don't know, that thing wasn't very good, it doesn't sit with me, maybe I did. So we included those maybes in the yeses. And after reading the comments, they were all yeses. And then those that said yes or maybe got the option to complete an open text comment to give us more information. And 626 women wrote comments about obstetric violence. That means, though, that 365 women didn't feel that they could share their stories. And this paper is for them as well. This is for their silence. We then did a content analysis, which was really going through every single comment, and both the research assistant and myself did that. And this research assistant in this experience actually is my husband. And it was a harrowing experience. It was harrowing watching him read them and having to get up and walk around and then go back and read them again, and then for me to read them all, but not as harrowing as experiencing obstetric violence. I had a strong desire from the very beginning that we closed the survey, and I realized that there were 626 comments, that this was the first piece of data or first question that we analysed. And this strong desire really came from the women that shared their stories. I imagine it as ripping open their wounds and bleeding into this survey to share their story. And then we expect them just to get back up and get on with their lives. And as women, I know they did that. And I'm so grateful for that. So let's just reiterate. We then found in the survey more than 1 in 10 Australian women had felt that they had experienced some form of obstetric violence. That is really quite significant. If we think about the numbers of women that come through our maternity services, and you look at a group of 10 and think one of those women will find this to experience obstetric violence. We need to do something about that. So the content analysis, this is going to be a bit tricky to read, but don't worry, I'm going to go into more depth. And this is just the table that is in the paper as well. And just to show you that there were a series of main categories and then subcategories, and then we put the number of quotes in there and the percentage of coverage. But you can certainly access the paper, which is open access. And we use inductive content analysis, which means that the analysis comes from the data rather than us going in there with a framework to begin with. So there were 3 main categories. That is, I felt dehumanised, I felt powerless, and I felt violated. And I'm going to go into each of those 3 main categories now with quotes. So just another quick warning for you. I felt dehumanised. This was the largest category. There were 432 quotes, making up 58% of all the quotes. That might not add up to the 626. I didn't kind of explain. A lot of the quotes we had to break down into other items of coding. So there was more items of coding and overall than there were quotes that were left. This category included experiences where women felt they weren't being treated as a human who deserved respectful maternity care. The subcategories included disrespect and abuse. I was nothing to them, just a body. My pain wasn't real, and the ongoing trauma for both of us. This woman summarizes dehumanization. I felt dehumanized because A, nobody told me the procedure was optional or gave me choice to opt out. B, I was very clearly highly distressed and they didn't pause or stop the procedure to check my consent. C, there were 3 people I didn't know standing and looking at my exposed naked body. And D, the midwife had joked about the procedure. Now, we don't know what that procedure was, and I don't think it matters. It's the fact that how she felt about that procedure. A few other quotes were being lied to about my baby dying to force me to sign forms, performing medical procedures while I begged for them to stop, and being told I have no choice in being cut. Or being held down on the bed so people could do things to me, having my experience and education dismissed when discussing my birth choices, being bullied into having an unnecessary vaginal examination. And one woman got hold of her notes after her birth experience. And this is what she said. I looked up the notes to this birth and my chart had PITA and in brackets, pain in the arse, because I refused a C-section at 38 weeks. And some more quotes of dehumanization. I feel like I was treated as an object and they only cared about the baby. They didn't care, this one on the slide, they didn't care what damage was done to me or my baby, or my body, sorry. They just wanted my baby out. I was a vessel. And another final one, I wasn't a human. I was nothing to them, just a number. Really quite shocking quotes, and to think that the maternity care services can actually result in a woman feeling that she was nothing, that she had no value, that she was really just there to have a baby. The next category, main category, was I felt powerless. This had fewer quotes, about 16% of all quotes, and they're made up of the categories or three subcategories. And this category captured examples where women experienced coercive language, were given misinformation, or were forced into interventions. The subcategory with the highest number of quotes was coercion. And in this category, women experienced feelings of pressure to conform to healthcare professionals' wishes rather than their own. One woman said, at 42 weeks, I presented for review of an ultrasound, and the doctor spoke to me like I was absolutely stupid, made fun of my wishes and told me it would suck to be one of the 4 in 1,000 women whose baby dies, in relation to me declining an induction and cesarean section for gestation. And this woman on the slide, I said no to the offered intervention over 6 minutes of repeated asking. I finally said yes when she coerced me by getting me on my back with anesthetic drawn up on a needle. I never gave informed consent. And the obstetrician berating me during labour and her telling my husband outside of the labour room that I might die so that he would be on her side in telling me to listen to her. Again, it's taken all that power away from women, a time when we really see labour and birth and pregnancy and new motherhood as an empowering and a life-changing experience to move you into your new phase of being a mother. But actually women are coming away feeling like they absolutely had no power. And then I think probably the most challenging of the categories was I felt violated. And in those categories, the largest of that subcategory with 124 comments related to vaginal examinations given with or without consent that resulted in the woman feeling that she experienced obstetric violence. I went through all of those comments and I wrote down the words, the descriptive words that were used by women. And they were words that would really be associated with sexual assault. I'm going to give you a list of those words. Penetrate, shoved, probing, rough, aggressive, violent, ripping open of legs, violated, torture, raped. Here are some examples. The vaginal exam where I did not consent that went on for over 5 minutes, and I was held by my wrists and told to sit still and be a good girl, while I yelled no and to stop repeatedly while moving up the bed. One woman said one time she, and it was an obstetrician, didn't even tell me she was going to penetrate me, and I almost flew off the table with shock and pain. One woman said, my birth experience was like being raped repeatedly over a 25-hour period. And one woman said, really quite poignant statement, we live in the Me Too generation. If someone wanted to have sex with me and I said no, and then kept saying no, and then they told me someone I loved would die if I didn't agree to it, that would be rape. I don't see how my experience was any different. Other subcategories included physical assault, such as really rough fundal rubs and women really not understanding why that was happening, or did they need to be that rough, and the grabbing of breasts during breastfeeding. And the other subcategory, and there was an entire subcategory on this, was episiotomy. These are really quite shocking stories, but I think they're important and they're not made up. And these are women's real voices and stories that they shared in the birth experience study. But I think now is a good time to pause, because I'm going to move on to look at how do we address obstetric violence. So now let's just have a little pause, and I'm happy to take some questions.
Thanks, Hazel. It is very shocking, and I think we almost need a breather to kind of not accept it, but kind of understand what you're saying, really, because it is shocking. But we have had a question. Kim Wilkes, hi Kim, has said, totally curious, would we not be liable if the intervention was stopped and the baby died? It's a good question.
It is a good question, but I think that in any situation, we can use kindness and we can use respect, and we need to get consent. There should never be a time that the woman hasn't really understood what is going on unless she is unconscious. So there's always time to get consent. And yes, it's shocking. We do see the baby dying as the ultimate bad experience. But actually, if we have women that are feeling violated, dehumanized, and powerless, then once that baby who comes out alive goes home, what is the state of the mother who's going to be caring for that baby? You're not going to be there. You're not going home with them to care for that baby. The woman is. And it's very difficult to be the best mother you can when you are having ongoing issues from obstetric violence, which can include PTSD and a myriad of perinatal and mental health issues. So what can we do, though? What can we do to address obstetric violence? And I've got 3 areas that I'm going to talk about next. One is the reflection of your own individual practice. The other one is respect education. That sounds a bit strange. It looks like we should respect education, but I mean respect for maternity care education, and I'll touch on that as well. And the last is obstetric violence legislation, and I'll explore where that actually is in place and what we potentially need to be pushing. Okay, we need to talk about vaginal examinations. They are a routine internal examination of the vagina, cervix, and fetal head within a maternal pelvis. During labour, vaginal examinations can be performed every 4 hours. That's what the policy tells us, or more. Yet the role and impact of having a vaginal examination is rarely discussed. In this study, it was evident that a vaginal examination can become a sexual assault. A negative vaginal examination can be exacerbated by the power imbalance between the healthcare provider and the woman. With the woman lying supine, her legs are opened, and gloved hands insert 2 fingers into the vagina to check cervical dilatation and the presenting parts of the baby. The examination can be quick or long, easy or complex, gentle or rough, and this is all dependent on the healthcare provider. If you add a lack of consent and a lack of explanation, It is easy to see how this practice could be experienced as a violent, intimate assault. Is it just the consent at the beginning that we have to get? No. If the woman says no at any point during examination, we have to withdraw our fingers. But that's not what always happens. And a withdrawing of consent and not the withdrawing of fingers was often mentioned in these comments. And there were times that other things were done without the woman's consent. I'm just going to do a quick VE, and then the membranes are ruptured without ever consenting to have the membranes ruptured. I'm just going to do a quick VE, and a scalp clip was attached to the baby's head without actually ever getting consent for that. During pregnancy, I'm just going to do a quick VE, and a stretch and sweep is done without the woman's consent. We can see how this can happen. And one that I think many of us will have witnessed and may have even done is a woman consents to a vaginal examination in between contractions. And she lays down and she's not having a contraction, and you start the vaginal examination. And then she starts to have a contraction. And that is extremely painful, especially when you're lying on your back and you've got fingers inside you. And yet the examination continues. I just want to see what your cervix is doing during a contraction. To be honest, if you need to find that out, go and read your anatomy and physiology. We're pretty sure what would happen to that cervix. And the woman never gave consent to have it happen during contraction. In fact, give it a go. Ask a woman, I'm going to do a vaginal examination, and while you're having a contraction, those really painful contractions you've been having, I'm just going to stay in there the whole time so you can't move. Is that okay? See what the woman says. If she then gives you your full consent, well, then you've got consent. But I don't think women are given full consent for all vaginal examinations. As midwives, we need to explore trauma-informed examinations. We need to understand that so many women come to our service with a history of trauma. We've been exploring that. We've asked women in the survey, and looking at the trauma that women come with, there is so much. And much of that is to do with previous sexual assault. Imagine then a woman coming in with trauma and we're just giving her more trauma. What are we doing to women, and what kind of mother can that woman really aspire to be when she has been re-triggered from any previous trauma that she's had? As midwives, we do need to explore this, and we need to have more trust in the use of external physiological and behavioural signs to display progress in labour, such as observing the purple line, movements and positions of the women, and vocalizations in place of routine VE. I say this from a point of experience. For many years, I was a home birth midwife, and I did very few vaginal examinations, but I did a lot of watching of the woman. A vaginal examination can be a respectful, consented internal examination or a sexual assault. How do you want women to experience them? The opposite to obstetric violence, I believe, is respectful maternity care. So we need to focus on respectful maternity care and really teach what this means. It's no good just saying give respectful maternity care if we don't really know what that is, or we haven't seen it modelled by other midwives and doctors around us. But there is some amazing resources out there. This toolkit, the Respect workshops, I have the little song Respect going on in my head now. This toolkit is available on the ICM website. And it has everything you need to create your own workshop. And there are some amazing UK midwives that have been part of this toolkit. You could organise one in your own workplace. But we also need to bring this into the early education of our student midwives and our medical students. Even better, bring them together and teach it in an interdisciplinary workshop. I love interdisciplinary education. I run an entire subject on collaborative care, and every single workshop is with a combination of different healthcare professionals. medical students, social work students, psychology students, paramedic students. We have a really good time. And what we do is we break down those barriers, because this being a small world, they are going to likely meet that person, meet that medical student, meet that psychologist, meet that social worker at some point, and they have already got to know each other. They've understood each other's roles at such a deep level that respect comes from that. So bring them together, bring our students together and learn, what is respect? What does that mean? Because believe me, they get indoctrinated into our language and our practices so quickly. And those of you that are educators in university, you know this. They come back after the clinical placements using terms that you know are not particularly respectful, or they're telling you about experiences and they themselves are so traumatized about watching this. So give them the tools to be respectful. And you need to learn these tools, and your workers, your colleagues need to learn these tools to get hold of this workshop. And there might be other things out there, but this is a free, amazing resource. Everything's been written for you. Download it, bring respect into your workplace. You can be part of that change. So be it. So obstetric violence is gendered violence, and women should be protected under legislation. Speaking from Australia and also from the UK point of view, we need to elevate the issue of obstetric violence. Legislation identifying obstetric violence as both gender-based violence and clinical malpractice has been introduced into 7 of the 11 countries in Latin America, starting with Argentina in 2009. Yet here in Australia, in the recent draft version of the 10-year Australian National Plan to End Violence Against Women and Children, there was no mention of obstetric violence. There needs to be a wider recognition of obstetric violence and a combined approach to address OV in Australia, in UK, and internationally by the obstetric and midwifery professional colleges in collaboration with maternity consumer organisations. Let's come together. This is not a blame and shame. This is a let's get together and act. I recommend that obstetric violence be recognised as a form of gendered violence internationally, but most definitely here in Australia, with the implementation of legislation protecting women from obstetric violence. So many healthcare providers, we act with fear of us getting into trouble. And that's often why there are so many interventions and so much monitoring. If this baby dies, I could get X, Y, and Z. I could get taken off the register. I could lose my license. I could lose my registration. And we live with that fear. But what if we just added, if I cause obstetric violence, I could get into trouble. I could be dumped for clinical malpractice. Well, maybe that would make people stop before they go into that room, before they do that internal examination, and just say, have I checked all my respectful maternity care? Have I got consent? Have I got consent for the whole procedure? Have I treated this woman with respect and kindness? So that's kind of it for my presentation. The paper is published. It's open access. There are links in the resources, and you can find it in the journal Violence Against Women. I'm going to finish by returning to my belief statement. I believe all women deserve respectful maternity care, free from harm, abuse, and disrespect. Do you? Thank you for having me here today, and here are my contact details. I will add, I'm really active on Instagram, so find me on there. I love Instagram at the moment. That's my favorite platform.